Witam Państwa bardzo serdecznie. Mam przyjemność gościć dzisiaj doktora Mario Goisisa z Włoch, z którym będę miała przyjemność przeprowadzić wywiad na temat lipotransferu. Mam nadzieję, że ten cykl spotkań przypadnie Wam do gustu. W tle widzimy przepiękną panoramę Szczecina, także poczujmy się jak w porannym programie śniadaniowym. Okay, I want to introduce Dr. Mario. Mario, can you say something about yourself?
Of course, I'm Mario Goisis and I'm working in Milano. My clinic is in Milano, but I'm working even in Harley Street in London and in Dubai, and it's really a great pleasure to be in this wonderful clinic and especially in this beautiful clinic in this city.
Nice. I hope you're gonna like our country and our city. And can you tell us a little bit about your technique? Because your technique is amazing. Can you tell something more about the lipotransfer?
Thank you. Yes, we will work with this minimal invasive technique. We call it derm graft and enriched nanograft. We work with the deep dermis. So it's an advanced technique, a regenerative medicine technique, very fast to do. It will take 20-25 minutes to do for procedures from the beginning to the end. You know me.
Of course, you're very fast.
I do so many live treatment during our congresses, during our courses, and by this technique we can make a really improvement of the face, of the neck, and of the hands.
And of course for the body also. So
for the body, we will harvest a bigger quantity of fat, so we need to do remodeling. We call it liposculpture. So we need area with excess of fat, for example, the culotte de cheval, the abdomen, and so on. And by injecting this fat in excess on the breast or in the buttock or in the calf, we can have a double effect. So reduce when there is too much and add when we need volume.
Amazing. Mario, I'm in love with your result for the face and mostly for the noses. I think when you touch the patient with the fat and you can enhance the profile of the person, that's beautiful. Can you tell me how you can see the beauty of the person, how it is? So you're looking for someone, so if your patient comes into your office, you can tell someone right away what they need, or they need to come to you with the idea of what they need, or you just tell what they need, how it's for you, how it works for you.
How it work for us. Finally, we are artists. So
yes.
The first thing is to understand what is the most beautiful proportion. We change from patients to patients. By working in different cities, I have patients coming from different countries, from different continents. So this kind of proportion change between Asian, African, European. But talking about European, about Indo-European people and so on, we have to understand and to clarify some relationship, like the relationship between the nose, the lips, the chin, the dimension of the face. We study this kind of proportion, and after we study is like this. When we observe our patients, we immediately understand, you agree with me?
Of course.
What is the way in order to improve the beauty.
But also, I know you love the natural results. So not those big lips, and it's always about the beauty, but those natural beauties.
Of course, beauty has to be natural. Darwin, who first described the correct proportion, the evolution of the species, talk about koinophilia. Koinos means normal. Everyone love normal proportion, common proportion. If we make too much big lips are not normal, so are not beautiful. Perhaps some of our patients ask to us, doctor, I want more, because that is the difference between which people like and which is beautiful. But we have to look for beauty. Even on these patients, we have to say, no, I'm sorry, you have too much big lips. We can improve your face in different way, but for lips we have to stop.
How often you refuse to do the procedure?
Oh, it's quite common with new patients, but with old patients, usually they know me, so they even do not ask to have too much excessive treatment.
I have another question because we are talking about the fat transfer and the lips. Can you tell, because I'm very into the lips, you know that, but can you tell the difference with the fat graft into the lips and the lips with the filler?
Yeah, first of all, we have different in terms of material. So if we inject the lips, usually we need 2 or 3 times of injection. With fat, we will have a long-term result, but it will be a different result compared with effect that we can obtain with filler. Because filler is injected in a different layer, in the different area, and allow us to have more definition of the lips. So every time I say to my patients, if you want to show to other people that you did the lips, it's better to use hyaluronic acid. If you want an extremely natural result, if you are older than 50 years and you have a reduction of the volume of the lips because of your aging and you want only to restore the volume which is loose without changing the shape of the lips, fat is the better solution. But if you want to show very strong lips with different shape, then it's better to choose hyaluronic acid.
Of course, and another question, so it's not a problem if someone had lip filler before and then they want to do fat graft, it's not a problem?
No, 90% of my patients did filler before, it's normal.
And another question about the results. So how long results stays? For how long we can have the results after fat graft?
Yeah.
Because you told that there are like long-term results.
So usually we need to do 1 or 2 touch-up after our procedures because we have some resorption of the fat to inject. But after that, I have patients who come back after 5 years, one even after 10 years after the first procedures, and they still have are still better than before the treatment. So after 10 years you presume that you have aging, you have loss of volume, but these patients were better than the photo before 10 years ago. So we have stable result, long-term result with fat. It's very different that with fillers. With good filler, at least we have full resorption of the filler. With fat, no.
So when we are doing the treatment, then we need to wait how long to see the final result? Like
4 months.
4 months.
Yes.
Okay. And how it's about the post-procedure? How it is? It's a lot of swelling. It's bruising. What do you tell your patients when they come back to work after the procedure?
You know, I had last year one former Miss Italy.
Okay.
Who come at last minute with 2 hours of delay it was 6 p.m. I still remember, and she ran in the clinic and she said to me, Mario, I want to do the same treatment of the last year. I want to do injection of derm graft and nanograft. But I'm on delay, we have to be fast because at 7 I have to be at the national TV office because at 8 after the makeup I need to do my live, and it was one of the most important TV program of Italy. So he said, darling, it's not a good idea, come back tomorrow. And she was upset, she said me, but last year I was beautiful immediately after the treatment. Yeah, usually it's like this. Immediately after the treatment you don't have big swelling, you don't have bruising usually.
So actually I remember when I was in your clinic in Milan 4 years ago.
Yeah.
And I still remember we did procedure for one of the TV show presenter.
Yeah.
And she did, same day, she did like normal TV show.
Yeah, but that was a normal. The one who I was talking about, it was one of the most important TV show on Rai 1. So I say no, it's not. Usually it's like this. Usually we don't make bruising. Usually we don't make big swelling. So normally you can come back to work the same day or the day after.
Same day or day after. And very important thing, because the old techniques, I think it was always like hyper correction for the fat, and right now you are doing this soft result, so you avoid this hyper correction.
Absolutely, yes. We can say that around 1 hour after the injection, because immediately you have some swelling, you have to be beautiful, not to be with too much big cheekbone and so on, because in many of our patients we don't have so much resorption, so we don't need to add more fat than necessary.
And what about the sport after the treatment? Can we go back to the gym? Can we go back?
Yes, after
normal life?
2 days you can go back to the gym.
And the sun exposure?
If we don't make bruising, and usually we don't make bruising, we don't have any contraindication to sun exposure. We have to avoid too much sun for 1 week. I intend to stay at the beach for the full day in the central hour of the day, but despite of that, we don't have any kind of contraindication.
And another question, how are we supposed to be ready for the treatment? Any special advice? We need to prepare in some special way?
No, of course you have to discuss about the indication of the treatment with your doctors.
But if we are healthy, so
no special preparation. We don't need special before.
So we don't need to go to the labs, taking blood exams, bringing it to you.
Absolutely no.
Because it's small, it's not non-invasive procedure. Yes.
That's right. The only things that we suggest to our patients is if it's possible to do before the injection some treatment with stars, shock waves. You have, it's a great machine.
But also for face or only for the body?
For face and for body. For face, because of the application of shock waves on the face, improve the vascularization of the area. In this way we will have better survival of fat. And for body, because of even in the donor area, the area in which we harvest the fat, we will have an improvement of the quality of the stem cells. We did this scientific study with the University of Verona, in which we demonstrated how better are the stem cells that will improve our dark circles, our hair, our quality of the skin, by treatment before the harvesting with shock waves.
Oh my God, I've got so many questions for you, and another one. So, which are the places where we can take the fat from? So we can take it from the belly, the flankies, or wherever.
You know, I have many models in Milano who come to do lips, nose, and so on.
And they're very skinny.
They are very skinny. Despite of that, we can find fat even in extremely skinny model who stay 6 hours a day at the gym and they eat only salad, but we can still find fat, so it's not a problem. But of course, every area is good for harvesting. I prefer to harvest from the side, from the flank, because it's a very good fat without cellulite and without fibrosis. But
if we want, we can take also from the
knees, a very good fat,
or from the chin.
From the double chin is a very useful harvesting because we have double improvement. Nobody like a double chin. So.
Yes, we've got a lot of patients here in Poland. You know, I have a lot of patients with the problem of the double chin. So if someone got fat here, you told me yesterday that we can take fat from the chin and then we can double chin and then we can make it look better from the side.
Of course, when we have retrusion, when we have not too much projection of the chin, when we need to add volume to the chin, we use the same fat of a double chin, so we have a double effect. And with our double chin technique, which is a combination of removal of fat, injection of fat on the chin, and insertion of threads, I love to use aptos threads, for example, we have an immediate effect without bruising and without long downtime. So we don't need to take to a compression of the area to put a garment, and we can come back to normal life quite immediately. So it's very, very effective and it's very easy technique for our patients.
Perfect. So we can treat double chin, we can treat whole face, but also I want you to talk more about the dark circles under the eye, because I think it's the problem of every woman here. So what about those eye region?
You know, when 8 years ago, I published this book for Springer Nature about the injection of filler. It's translated even in Polish and in other 8 languages, Korean and so on. And I describe my technique of injection of dark circles with hyaluronic acid with cannula. I did it, and a lot of doctors are using that kind of technique, but now, thinking about it, it was not the proper suggestion because a lot of patients have complication with that technique. And I review, even now, patients who did this treatment 5-6 years ago, we still have swelling of this area.
Okay.
It is a complication that we can solve, but still is very boring complication. So it should be better, in my opinion, every time I say to my patient, let's do not use hyaluronic acid, let's use nanograft, stem cells, because in this way we will not have swelling and we will apply, we will improve only the skin and the color, the darkness, because stem cells works even in the production of melanin, so they play a role even very in this kind of problem. So we work in a safer way. We will not have edema, we will not have swelling, and we will have a very good result. Usually, the best results are observed 2 months after injection, are not so immediate, because stem cells have to work, but when they work, the result is great.
So when we are talking about the stem cells, I think you need to tell us something about the face rejuvenation with the stem cells. So your technique and the fat graft, it's not only about the volumization, about the changing of the face shape, but also about the condition of the face.
Of course, stem cells can improve the quality of the skin, and stem cells are present in every tissue, but in particular fat is very rich of stem cells. Usually we think about the bone marrow, about our complicated tissue to harvest, but fat is so rich of stem cells that by harvesting fat and by selecting the stem cells with our system, with our selective filtration, we can have a great emulsion, very powerful, in order to to stimulate the production of fibroblasts, to stimulate the production of collagen, to improve in a very strong way the quality of the skin. So stem cells are the future really of aesthetic medicine.
I think at all the congresses we are going right now, regenerative medicine is like the top of the topics. So we are all talking about the regenerative medicine and everything. So I think this is amazing. So we can work on not only with the fat, but also with the fat cells.
Of course. It's the best solution, the safer one, because this emulsion, like for example the one we injected in dark circles or in superficial skin, in acne scar, in the neck, is a totally safe procedure because it will not create any kind of volume, so we don't have any risk of bumpiness and so on. And
so that's also the difference with the old techniques, with the lipotransfer and your technique. Can you tell us those difference?
Yeah, usually I even do not define my technique lipotransfer. I prefer to call about derm graft because first of all, the layer of harvesting is more superficial. Usually with old lipotransfer we harvest deep fat. With our procedures we will harvest deep dermis, is more rich of stem cells. It's not dangerous at all, so we don't have any risk of embolism in the harvesting area, so
which is very important,
so no risk about it. We harvest a minimal quantity of fat, so we can do even in slim patients.
And how much of the fat, how many mLs mostly you are doing for the face, full face?
10 ml, 10, 15 ml, so minimal quantity, and we harvest 10, 15 ml. After that we have a closed system of processing. It means that we don't have exposure to the air, so we don't need to do in a big operating room. We can do in a small treatment room because it's a totally clean procedures. We use only single-use instrument. It's very dangerous to do sterilization of the cannula, not only because of risk of cross-infection, but because it's very difficult to remove all the fat of the previous patients. And so we have some antigens, some things which don't make our treatment successful. So it's very important to use sterile, safe, clean, single-use kit. And after that, during the processing with selective filtration, we have as final result a product very rich of stem cells. We compared our product with other product on the market, our kit, and our system is faster, is more efficient, and is very rich, is more rich of stem cells compared with the other one. So it's very, very effective.
Okay, amazing. What more I can ask you? Of course, I think everyone wants to ask, is it painful? Because I don't know, do you use any anesthesia or?
Yes, we do some point of anesthesia on the face. I can say that in so many patients I do full face treatment and I combine my fat, my derm graft injection with injection of Botox. Why? Because botulinum toxin is very effective for these wrinkles of expression. And I do Botox as last procedures because when I do Botox the patients say me, now I feel real pain. So yeah, I can say that it's less painful than injection of Botox.
Okay. Okay, so I just want to come back for the regions we can do, and I'm very curious about the nose again, because some doctors they prefer to do the filler for the noses,
yeah.
And I know you prefer fat, and you can very nicely smooth the bump at the nose. Can you tell us why you choose the fat or filler, when and why?
So dermograft is really the perfect filler for the nose because we can inject dermograft even in bigger quantity. Why in bigger quantity? Because we don't have the swelling which is typical of filler. So we can have the best correction of the nose, and despite of that, usually we need one touch-up, in some patients even we don't need, we have a stable result. So when we have correct the shape of the nose in a stable way, we don't have to come back like we have to do with filler. With fillers we have to repeat the treatment every 6 months, every year.
And with fat?
With fat, no. When we have our stable result, so perhaps we need one touch-up or two touch-up, and we have the final stable result, and this is very important for the nose, which is a very delicate area.
And you are working in the nose with cannula, of course.
I'm working in the nose with cannula. I'm working in the nose with cannula even when I'm injecting filler. Okay. Some patients want to see the result before having a stable treatment. So in this kind of patients, sometimes I use filler. I show to them the result, and after 6 months, 90% of my patients prefer to inject, to move to fat and to dermograft.
Amazing. And what about the breast? Can we do also the breast with the dermograft?
Yes, so we can do the breasts with dermograft. We need fat, so we need some area in which we have too much fat, because if a patient is very slim, it's impossible.
And we
to
need
do
a
the
little
breast.
bit more of the.
And we need more fat, of course, compared to with the face. With breast we can increase 1 cup maximum, usually. And we have a very natural result. It's impossible to understand that the breast was treated with fat. We have exactly the same characteristic of normal breast. With our technique, with minimal dimension fat particles, we will not have risk. We never observed till now cyst, like with old technique on the breast, so the result it will be very soft. But if one patient, like we say with the lips, want very, very big breast, it's better to use prosthesis. If you want to show that you did breast, if you want to show a super décolleté, it's better to show it with prosthesis.
Okay, amazing. I think it's very interesting what are you doing, and I hope you're gonna be here more often. And if you've got more questions, feel free to ask them or write them under with the comments, so we can answer your question. And thank you, Mario, for coming here to Poland, and I hope to see you here more often. And thank you for this amazing interview, of course.
It's a pleasure.
Thank you.